Hello, everyone. Um, I would like to first acknowledge Healthcare Systems Engineering Center, University of Illinois, Champaign, and Jump Archers Endowment, and OSF Healthcare for supporting this project. The objective of the project is very simple. We know that simulation-based education has increased a lot, and it has a lot of impact. But the complexity related to creating the clinical environment in VR has always been a hurdle because the real world environment has a lot of parameters like patient physiology, emotions, clinical team behavior. So these are difficult to bring them immediately, or without simple effort, we cannot bring them inside the virtual reality. A lack of effective software for instructors is a really big hurdle for them to create a curriculum that they immediately want to present to their student, like how we create a PowerPoint presentation for our students. Like the next day, overnight, we will prepare a PowerPoint presentation, right? Something like that is not there. So. And clinical education and training are not very simple. Like it's a complex domain with rigorous amount of knowledge and skills. And the conventional way is like having a textbook or like a practical lab or a workspace training. These are like the conventional way of training and getting the education. And medical training process has limited cases that they actually train with, and there are multiple scenarios that they can get exposed to over the period of their practice, but during their 4 years of training, it's only a limited scenarios that they actually get exposed. And the education opportunity is not equally available for every student, and it's an expensive and a time-consuming process. The approach that we tried was to create a platform which will help creation of these virtual reality education content like really simple. And we call this software interactive mixed reality. So in our approach, instead of creating the virtual environment completely, we try to replicate it with the 360-degree video. And this gives a first-person view as per most of the feedback from our study participants. And more than just the 360-degree video, we annotate it with a lot of other extra information like text, image, videos, and 3D models, and patients' data. So these extra added information makes it like an interactive curriculum that they can actually see, like a movie kind of thing with more content. Apart from just seeing these content, there's also like assessments which they can go through, so that more than just see and learn, are they actually observing the knowledge that we intend to deliver to the student. So the usability of our software was tested by creating a sepsis prevention education application. And sepsis, in short, I will explain. I'm not a doctor here. So sepsis is actually a medical condition where it's like a problem worldwide, and it results due to infection. If the infection is not like diagnosed or treated properly, it will rapidly develop into a septic shock, and then it can cause organ failure or even death. And training a medical, like a new resident or a novice person is like essential, because if they miss a septic shock, they will actually be in a lot of trouble, and the patient will be in a complex health condition. And to evaluate this, we did an efficacy study, and we used the sepsis scenario, and we had participants provide feedback on their experience with the study. So we started this with analyzing the tasks that are involved, and we had like 4 basic techniques, like what is the situational assessment, what is the decision making, and what are the tasks selection, and what are the task as activity learning. So these 4 categories, we try to group them, and then we try to see what are the things that they need. Like, for example, I will briefly say for situational assessment, when the patient is like brought inside the emergency room, there is like an high alert importance that they have to give, and immediately they will provide a lot of attention to the patient, and they will try to respond what is the patient scenario, and this requires a lot of cognitive demand. Like, they have to respond really fast, and they have to make a really good accurate examination. And the next thing is like the examination process. The assessment process is as such, we will think that we will just start with patient examination as observing them or taking vitals, but it actually starts from stage 1, where the paramedics who brings in the patient will be like first having a communication so that he understands what was the initial state of the patient, and then then it goes to understanding the physical status of the patient, then observing what is the communication that the patient can make, and how much of the vital information can be. So there are so many stages of assessment itself that needs to be like learned in the first the stage of situational assessment. Following this, the decision making, this is actually not like something you can immediately learn. This is a process where the knowledge and skill is like taught gradually to a student over a period of time. Like, for example, the thought process that goes inside a clinician in assessing a patient and providing a medication is a detailed thought process. So when a clinician is performing an immediate emergency situation, that clinician will not be able to elaborately explain to his student who is like assisting that clinician, saying, I am giving this medication because I see the vital like this, and I see that the analysis of my patient's condition and the analysis based on the patient's history, and I'm deciding to give this much amount of dosage. So this is an elaborate thought process which goes inside their mind in a fraction of a second, and they won't be able to explain this in detail when they are like teaching a student who is assisting them at that time, right? So with 360-degree video, we thought we will be able to enhance such informations with annotated informations and tasks. So there are a lot of tasks that happen, and each person actually switch their task. So as a team, you have to work in a really like a synchronous way. So and also the task learning, there is like a knowledge of what is the procedure, and there is a knowledge related to how to do the procedure. So these knowledge also is like an important factor that if someone makes a software, we have to have all these 4 things addressed so that it becomes an effective software. That's what we thought has to be like mentioned in our work. So with this in our mind, we try to address some of the methodologies that we analyzed. And in terms of the knowledge, we thought having a 360-degree video capturing a training scenario will provide a similar immersive environment as if a person who will be like standing inside the an emergency room and then observing the procedure. For this, this is like a unwrapped view of a 360-degree video. So what you see here is actually a standardized scenario. Yes. This is a patient who is like a standard patient performing a septic shock, and he knows how to react at various stages. And while reacting at various stages, a student will be like standing there and observing that patient, and he will see how the clinician is like responding to various actions at different stages. So this training scenario, we captured it, and we tried to improvise it with our software with more information that happens in other media. So we had a knowledge, like information about sepsis. There's an assessment that we try to incorporate. And we had a study that we designed, like a simple goal of obtaining feedback on how the sepsis application is. And we had like 28 students who participated, and we used HTC Vive with a controller to do the study. And we actually had 2 different versions, one version which is like a longer version of 21 minutes and a shorter version of 4 minutes. So we tried to use the 4 minutes version to provide them a shorter experience with sepsis. There were detailed description on how we chose the students and what were the eligibility criteria, and the demographic details, what were we trying to collect from the users before the study. So we tried to see what is their experience related to mixed reality, what is their experience related to programming, virtual reality programming, gaming experience, VR gaming experience, and their experience related to watching 360-degree videos. And after their study, we try to ask them 2 different questions. One is the NASA-TLX, and the second one is the system usability scale. In these 2 studies, we have like, these are standard studies, and I'm running short of time, so I will try to rush through the results now. So in the results, we had results for demographics. We had like 4 different categories: no experience, and beginners, competence, and proficients. So there were like a majority of the people who did not have VR programming experience or any, most of them identified themselves as a beginner with a normal programming experience. And there was an equal amount of distribution with conventional gaming experience, and VR exposure was also like not that high in terms of the number of students who participated. And from the NASA-TLX result, we were able to identify that the mental, physical, and temporal demands were not that high. It was really closer to medium or low. And the performance was high, and the frustration level and the efforts required from the participants were also not high, and it was like closer to medium and low. And from the results, we were able to say that the software had a high performance score, and the demand for mental or temporal or frustration or effort was in the category of low or medium. And in comparison for the result with respect to the demographics, we were able to see that with even though like a large population of participants did not have mixed reality like VR gaming or 360-degree video, they did not experience a lot of like a mental or a physical or a temporal demand, and they did not have a lot of effort. They were in the low and medium category. And the participants actually, the other perspective of the same categories is that the participants did not have a complete medical background, so it requires still like certain amount of engagement, which even represents like what is the, why is there even a low or medium category of temporal demand, because it is an education and it will still require them to be engaged at certain level, right? And furthermore, there was a lot of beginners and programmers in beginners category, and even those people did not have even those people felt like the performance of the software was really good. And the second study was the system usability scale study. So here there were like 10 different questions that we asked, and most of them participants actually agreed with the results saying we had like 10 different results, and I think it will be better if the paper will be like describing these in detail. So I will skip this for now and go to conclusion directly. So the enhanced simulation training that we can develop with the IMR software can actually accelerate their clinical exposure, because certain clinical exposures are like provided to a medical student only in the 3rd year or the 4th year of their education. So if certain education content are like able to be created instantly by an instructor, this will be like immediately delivered to a student, which can accelerate their exposure of what is happening happening in an OR or an emergency room. And the pre-recorded real-world, like the 360-degree video, enhanced with rich contents like the annotated information or the quizzes. These things actually improve the learning content that we can provide to a user. And showing the results that we presented in the paper actually shows us that the software is actually a usable software with a really high score of NASA-TLX and a system usability score. And we are planning to actually further perform more studies related to how we can get the validation related to the education content out of our software, and this is only the efficacy study that we performed for this. Yeah. Any questions?
All right, I think we have time for just one question. If there's no one, I will go ahead. So just quickly, so one of the things that you discussed was the desire to make this easy to create so that a creator could easily create this content. What is the authoring process for making this annotated 360 video content?
Yes, that's a wonderful question. So we want to create, so we have a software which can drag and drop certain components that you already have. And let's say, for example, if a surgeon wants to create a content and he captures the scenario that he performs, and he can just drag and drop and then click something with the controller and then create something. So the sequence in which he creates will be as similar to a PowerPoint presentation, how we have components that we can drag and drop and then put some text and then present something. It's a similar process. In this case, the core will be like the 360-degree video, and the contents will be like the questions or the images or 3D models or patient's data, which will be like in folders. So you can drag and drop them inside at different instances of 360-degree video, and then you can develop a content. Okay, thank you.
Let's thank our speaker one more time.